pressure on A&E has reached record levels. Last week, England's hospitals admitted the highest ever number of patients as emergencies. Over 7 days, more than 111,000 people had to be found a bed.
We've seen an unprecedented rise in the numbers of people turning up at our A&Es and needing admissions. We didn't really see the reduction in numbers we would normally expect in the summer. However, we still are ensuring that 9 out of 10 patients are either admitted or discharged from A&E within 4 hours. That's the highest standard in the industrialised world.
Even so, it's below what's expected and deteriorating fast. A&E should deal with 95% of patients in 4 hours. Last week, only 6 of the 140 major A&E units in England managed to meet that target, and performance overall dropped below 90%, the worst week since monitoring began in 2010. Not only that, the number of patients who experienced a trolley wait of more than 4 hours before a bed on a ward could be found for them soared by 30% in just 7 days. That statistic shows our hospitals are full to bursting, a huge worry just as the Christmas break begins.
There are a lot of bank holidays and weekend days, and those are the times where we find discharging patients safely back to their own homes or to their residential care is really very difficult because there are issues around the availability of transport, the availability of social services and the availability of primary care.
And to add to all of this evening is expected to be one of the busiest of the year for the emergency services. On the Friday before Christmas, hospitals deal with 3 times the usual number of cases of acute alcohol intoxication. The doctor who runs St George's A&E in South London has called in more staff, but fewer patients would be an even bigger help.
We are seeing unprecedented numbers of patients coming in this year to the emergency department, and any patients that don't need to be there are putting extra pressure on the system. Clearly, I can't overplay that enough. People need to think very carefully before they come to their local emergency department.
NHS England started planning for this winter earlier than ever before, but the pressures and the strains on the system have also come early. The real difficulties winter usually poses for the health service have yet to make an impact.